A pleasant day and a warm welcome to a favorite medical discussion, IMED. We focused many disciplines, many areas to enlighten you on certain medical aspects, and this series of programs is specifically focused on skin, which is the most vital part that you consider in medical conditions, and even in some sort of normal day-to-day life we consider about the skin. So today we are going to focus about skin burns. So hot water might be, sometimes might be certain accidents, emergency conditions, there might be certain burns occurring on your skin. Just what are the treatments, how can you proceed with, so on and so forth. We are going to discuss about skin burns, and we invited Dr. Tushan Benaragama, consultant plastic surgeon, to do the honors. Thank you very much, sir, for accepting our invitation.
Yeah, thank you very much for the invitation.
Right, okay, so today we are going to focus about skin burns. So sir, simply what a skin burn is?
Skin burn is due to various reasons, like the skin has different layers. It can be the skin can get damaged, maybe hot water, maybe flame, maybe acid, or maybe any corrosive substance. So the top layer of the skin, or maybe the entire skin, can get damaged. So we say it's either superficial burn or a deep burn, depending on the level of injury. So the problem is, the skin is our natural protective barrier. So once it get damaged, so it should heal properly, and then naturally it will leave a scar. So therefore I think that is the main concern in all of us, because we don't like to see scars in our face or entire body, because that will disfigure us. And so I think that is the main concern in burn injuries.
Right. So before moving to that scar formation, you just talked about two segregations. I might be not correct, the superficial and deep. Are those two the only means of a classification when it comes to burns?
And for the descriptive purposes, we say it's a superficial, because the reason is most of them they will heal spontaneously, that is without any surgical intervention. Or the deep burns, some of them or most of them they require a surgical intervention, maybe a skin graft. So in between, what we call intermediate thickness burns. So they might heal spontaneously, and some of them might require a skin graft, that is a surgical intervention. So I think for descriptive purposes we classify like that.
Right. So the major burns and minor burns, some people say, like ordinarily sometimes they might be not having a medical knowledge, it is a major burn. No, it's just a minor burn. Is that the major burn and minor burn, are they the same with superficial and deep, or any different context?
No, I think for the patient, any degree, it's a minor burn. For them, it's a major thing, because, for an example, a small child, just a small patch of the burn injury. So it's a major thing for the parents. So we cannot differentiate and say this is a major, but for technical purposes, our body, if it is a large area involved, we call it a major burn, and if it is involved in the face and the genitalia and those things, also we call it a major burns. But more than 10% of our body is burned, so we call it a major burn. But for the patient, I think even a small area, it's a major thing for them most of the time.
It's like some disease conditions, we say that 0.001% is contacted with the disease, but if a certain person is contacted, it's 100% for him. Right. So in these cases we consider about burns and major, minor, deep, superficial. Yes, the burns are there, and as doctor mentioned, a scar formation is the major thing that we consider. And so in certain cases, when a burn is there, ordinary people, they might not think about the secondary infection, what can we do, this is my naturally protecting thing. They said, right, my scar, will it disappear? What is that scar formation?
So usually, the Asians, we all have a dark skin, and we are more likely to develop bad scars. Not like the white people, we call Caucasians. So in general, even if it is just a small area, maybe it's called small area involved in if it is the face or even the hand, that can leave a scar. Most of the time what we see, the first question they ask doctor, like, do I get a bad scar? So their main concern is the scar, but it should heal properly first. The longer it takes to heal, the scar will be like, we call it like, in late term will be slightly a bad scar. So first thing, the most important thing, the wound should heal properly. So therefore that is why first aid is important. That is why the medical treatment is important.
Right. Okay. So we'll discuss in deeply with those disciplines, the scar formation, the first aid mechanisms and preventive things. So you might be wondering about how can you prevent from a burn. Yes, there are certain conditions when it comes to household activities. There are certain possibilities that you can encounter a burn. Right. So simply before exposing to that context, suppose we'll just take a practical scenario. A person just contact with some of a hot object, just only a few layers have been damaged. It's just, as you mentioned, a superficial burn. We'll just give a small medical advice to them and deeply move on to that context.
Yeah, it can be maybe a hot iron, maybe hot cup of tea or hot water. So the first thing the patient should do is just hold your hand, or if it is a facial thing, just go under, open a tap and go under the water. Because the idea is, because they call it cooling. So when you cool the skin, that will prevent, because skin has different layers, and it may be very, very small amount, but that will prevent the damage in the deeper layer of the skin. So the deeper the injury, the bad the scar. Right? And it will take long time to heal, and sometimes surgical intervention may be required.
Right.
So therefore the cooling is essential. So just go and open a tap, and or if you don't have the tap water, the running water, you should cool the area at least for about half an hour before you rush to the hospital. Because sometimes the natural tendency, can happen especially in small children. The parent can quickly take the child to the hospital. I think that is not the first thing they should do, because naturally they can get panicked. That is the normal behavior in that situation. But first thing they should do is cooling, because that will prevent or minimize further damage to the skin.
Right. So with that example, with that illustration, doctor mentioned about two basic things. When I pose the question, there's a minor type of a burn, might be superficial. You were able to hear that it might be a hot cup of tea, it might be a particular iron or something like that. And to the other side, the doctor mentioned about some holding to a flowing water, a stream or something like that. Yes, we have some practices and we have some first aid. So we're going to move on to the practice of first aid and even the practices that we encounter. So with that problem, we'll move on to the day-to-day practices that we encounter burns.
Because some people, they just apply, even we have seen certain instances where they have applied toothpaste or aloe vera, or maybe there are local remedies. Yes, people used to apply long time ago, but now when you talk when you describe and talk about the science, so the best practice is just to expose that area to running water, not to apply anything, and they then go to a doctor, the nearest hospital or the nearest general practitioner, and if it is a large area, so then go to the nearest hospital, because I think that is the safest thing a patient can do.
Right. So when it comes to the ordinary practice, sir, people might burn with hot water. Some close examples are there. People deal with hot water. They might be preparing tea. They might be trying to bathe a small child with hot water. There are some can you just explain some practical things that you encounter when it comes to this vast area of patients that come towards you?
Yeah, there are few common mistakes they make at home. So we talk about the domestic accidents, and these things you can easily prevent. One example is steam inhalation. So I think if you can remember, maybe couple of decades ago, maybe still it's practicing. Like, you know, you keep a hot water, maybe a jar or a basin, and you cover with a cloth and you inhale steam, because that is very, very dangerous, because you can fall into that if it is a child, or even like, you know, it can spill on your body if you keep it on another table or something like that. So that is dangerous. So there are what you call steamers, where they are not expensive. It's available in the pharmacies. I think you have to change your practice to prevent burns associated with steam inhalation. So that is one example. Other example is, especially like, you know, if you have children, don't keep the hot water or maybe hot cup of tea, because most of the time when they are, like, you know, walking, there's a tendency that they use the hand to, like, you know, grab something, because they can't see, especially when they are 2 years, 3 years, or maybe 4 years old. So don't leave any hot water or hot cup of tea or hot stuff where the children can reach. And the other thing is, like, you know, the people will take hot water and never carry hot water. If you want to carry hot water, that is for, like, you know, washing purposes, dilute and take them, because that also will prevent certain accidents. And the most important thing, now we all use gas cylinder.
Yes.
So we have seen, like, you know, these major burns associated with explosion or the gas leaks, because majority of our people, they keep the gas cylinder inside the house. I think that can be deadly, because if there's a tiny leak, because usually it happens where the what you call that connector regulator connects to the cylinder. Because you will not hear the noise, sometimes you will not smell it properly, and a little ignition can explode the whole area, and majority of the patients, they die, because it's a major burn. And so always try to keep your gas cylinder outside your house. But in most of the time, like, you know, when you are living in apartments, and I'm talking about the urban areas,
settings, confined areas.
So this, you might think that this is not practical, but you have to find a way to keep it outside in a open area, even if there's a gas leak. So then it will not cause major explosions and burns.
Prevention is better than cure.
Exactly.
So in those contexts, when it comes to the burns, you might encounter, right, okay, a burn is there, it's a medical condition. Yes, we can encounter burns, right? We have a discussion, we heard from a doctor, right? There are some practically impossible things that we cannot even think of in this urban setting. Yes, we understand there are certain limitations, but health is the major concern. If you might be having a lot of wells, you might be having all the facilities or infrastructure and everything, but if you can maintain this setting, it's just a normal ordinary practice. Even carrying hot water, you might have never think about it, just dilute it and take it. Once you spill that thing, once you encounter, just a matter of seconds, you will encounter a burn. It will be sometimes a lifelong consequence.
Exactly.
And in those things are practically the gas cylinder, preparing tea, dealing with small children, and so on and so forth. We have some practices, yes, we have to consider. So in certain cases, with certain negative thing that we have encountered, or might be an accident, burns might be there. And sometimes people try to have these home remedies, like things as running water, just as you advise, just a half an hour matter of a thing. sometimes people consider, right, burns like thing just that can be encountered, it's a common thing and it's most frequent. Don't we have any proper first aid for this?
I think the proper first aid is just cool that area, that is with running water. I think that is the most important thing a person should do.
Right. And sir, some practices are there, right, a burn is there, shall we keep some ice? Is it good?
Because ice because it's very difficult, because we will not tolerate even if you normal for more than 1 minute. So you cannot tolerate the temperature. So therefore it is not practical.
Not practical. And in some cases, what some people just they might be talking, yes, ice, yes, as you said, it's not tolerable. Will that ice itself cause some condition like burning?
In what you call usually if you just keep ice on a normal skin, it can, like, if you expose for a longer period of time, yes, it can damage the skin. But in a normal person, so because you cannot tolerate that temperature, so natural tendencies
you
will
put
take
it out.
it.
Yes. And so, like, what I wanted to emphasize is with what we are talking at the moment with burns, high temperature to this extreme positive end. To the other end, it is the lower extreme temperatures which we can encounter something like ice. Is it high end and the low end things? Is it like a common thing that we can discuss? As you said, that ice will also give some sort of a burn, a damage to the skin, and extreme temperatures, yes, it will damage the skin and there will be a burn. So in cases, some people might think, yes, if a person, right, for example, accidentally or tightly he is keeping a block of ice hole and he damages the skin, is that ordinary running water will help to maintain that condition? Or yes, can you explain that?
No, you can do that. You can even if you use ice, like the temperature, if you feel like it's very, very cold, yes, you can expose your hand or that area to running water. But I think the most practical way and the best, the advice is just use running water.
Running water, right? Okay, yes, it's very clear to you when it comes to extreme high temperatures and extreme low temperatures, different consequences might be there. We can just come to a common ground and talk about those things. Running water is as a first aid, don't just proceed with that, because having ice, yes, it will cause some burden and there might be certain other impacts to those areas. So doctor specifically explained. And sir, suppose that I have a small burn, I just hold my hand as you advised for a running water. Yes, doctor said about 30 minutes, half an hour. As I expose it to half an hour, then I feel like it's a minor burn, a small area, no any deep burns. I feel if I'm not having a medical knowledge, a person might think, all right, I will apply some cream that will help in certain burns. Yes, I can buy it from the pharmacy. What is your advice?
No, if the patient, even a small child or even a young adult, majority of the time, like, it can heal. But if there's a delay, we'll say a diabetic patient, and because in sometimes, like, we'll say silencer burn, maybe a small area, but usually the silencer burns are, majority of them, they are deep burns. So the problem is, like, now deep burns will not heal without any surgical intervention, or because if they get infected, so then the depth of involvement will be much greater. So that means that will leave definitely that will leave a bad scar. Therefore, I think even a minor area, I'm not talking about just maybe a small area like ₹5 coin like area.
Yes.
It's like, the significant area, I think all the patients should seek medical advice.
Right. So you might be having a small burn. Yes, you might be having some sort of a fuss with that burn. Yes, you can just have some home remedies and move ahead with proper medical attention. But the word that doctor specifically mentioned, if the burn is there, if that is not self-healing or if it needs medical advice, if you are not seeking medical advice, what will happen? A word you heard about, infection. So what is that? Is it a secondary cause, or can you just explain about
Yeah, it's a secondary cause, like, because our, like, there are different ways of treating burns. But if you know the scientific basis, because we don't have to do daily dressing changes, because every time you remove the dressing, it will, like, you might remove the new growing skin. That is one. Now, second thing is you can introduce an infection from outside. The third thing is, like, it is very painful. So certain burns, if it is superficial, we put a dressing and we leave it for about maybe a week, or in children maybe a little longer, and just allow it to heal properly. And once everything heals, then we talk about the management of the scar, because I think that is maybe the parents or maybe the patient's concern, finally the scar.
Right.
So the most important thing, you should prevent infections. And there's a what you call a vulnerable group, because especially, like, you say you get a burn injury in the hands or maybe the feet, and they are diabetic patient, their sensation may be poor, and finally, like, their anyway healing process can get delayed due to the infection.
Can amputation lead to such conditions?
If it is a deep burn, yes, it could lead, it can cause major infection, and then can lead to that situation. Therefore, I think the take-home message is, because sometimes you might not know whether this is a deep burn or a superficial burn, but the doctor can tell the patient, okay, and reassure, because that is the most important thing. Can tell you, okay, don't worry, this will heal, this is a superficial burn, or maybe it's a deep burn, but this might take little longer to heal, so you might require a surgical intervention. So that sort of a plan, it's important.
Right. So we discount what burns are, the practices that will cause burns, preventive mechanisms, and even some first aid related too. And most of the time what doctor emphasizes is that the scar formation, and at last you said about management. Can we just confine a small idea about the management of that particular consequence at the end of the program?
Yeah, so the management includes, like, there are different types of dressings. Some are really expensive, some are not. They are what called conventional dressings. And the most important thing is, depending on the situation, depending on the individual, so there are certain things, or we call dressings, they require. And if it is a deep burn involving a larger area, so then they need hospital admission and antibiotics and painkillers, and then the surgical intervention, that is to clean that dead tissue, and like maybe a dressing or maybe a later skin graft. So it all depends on the situation and the area involved. And the other thing is, if it is, we'll say, like, it's a flame burn, and if it is involved in the face and maybe the eyes, so therefore you have to, it can be, you might inhale that. So then you can get what you call the breathing issues also. So therefore it's always better to seek medical advice. If it is, we'll say, hot water burn, it can go into your eye. So we don't know without checking your eyes that it's involved in the eye. It's always better to, like, check it properly and exclude any injury.
Right. So burns are there. What we talk about burns, yes, there are home remedies, preventive mechanisms, and we have a good amount of knowledge when it comes to the maintenance, the practice of that condition when someone is or yourself is dealing with. Better to adhere those guidelines. But why we say so, that if you get some secondary infection, if you get some consequences, it will be difficult to manage. So I bet, yes, the program where we give knowledge in order to maintain a good well-being, a successful healthy life. Today we talked about burns, the management, how the treatments proceed, and how to lead a successful life when it comes to a burns, preventing that thing and managing it after the particular incident happened. So we thank Dr. Tushan Benrogama, consultant plastic surgeon, for doing the honors with us today in the IMID program. Thank you very much, sir.
Thank you very much.
Right. So stay tuned with the rest of the programs. I mean, just specifically focuses on programs to give you knowledge regarding certain medical conditions, and we'll be doing the same thing. Skin, yes, when we consider it's a vital part of the body, we'll be doing some more programs in this discipline. Stay tuned with I mean. Have a pleasant day.
If you keep eyes on it, you cannot keep it